Hi, everybody. For week 2 of clinical conference, I saw a patient RH who is 16-year-old, and she has a history of anorexia nervosa, panic attacks, a COVID positive infection, and severe major depression. And she came into the University of Michigan through EMS for a suicide attempt by way of overdose. So she ended up taking multiple prescribed psychiatric medications around 9:30 a.m. on the morning of January 9th of this year. Her grandmother reported that after she took the medication, she was initially like really sleepy, but that also progressed into lethargy. She was found unconscious and brought in by EMS, found by her grandmother. So the medications that she took escitalopram 20 milligrams, epiprazole 5 milligrams, bupropion 30 milligrams, and trazodone 50 milligrams, and she took 30 pills of each of those medications. So once she was transported to the emergency room, she regained her consciousness and was alert. Her labs and her vital signs were normal, but she did show some hyperreflexia and some clonus in her bilateral lower extremities. She was doing well, but then she ended up having some more increased somnolence and then had some seizure activity. Even after 8 milligrams of Ativan to stop the seizure activity, it continued. So they sedated her and intubated her. She was given Versed and fentanyl and transferred to the PICU for further management. And because of her risk of seizures and arrhythmia. So on January 12th, she was extubated and medically cleared. So that she could undergo a psychiatric admission post her suicide attempt. Her grandmother says that she's been dealing with a lot of anxiety and depression since COVID started, and she's also been having some self-injurious behavior for the past 6 months. She cuts with a X-Acto blade. She also currently denies any suicidal ideations with a plan or intent. So on assessment, for interval history. So fast forward to today, January 17th, going over her chart and looking through her nursing notes. RH has been having some difficulty with sleeping at night. She's experiencing trouble falling and staying asleep. On assessment, when we saw her, I asked, what was causing her to have, not be able to sleep. And she says that it's just being in the hospital and being in an unfamiliar environment. They did give her Clonidine 0.2 milligrams on the 15th for her difficulty sleeping, but it didn't work. And they also tried some environmental support, which also was ineffective. Prior to this suicide attempt and this admission, she was struggling with difficulty sleeping and was prescribed the trazodone. And she said that was helpful. RH also reports having a decreased appetite. She only ate about 25% of her breakfast, and then during dinner, she really didn't eat much of her dinner last night as well. She does have a current COVID infection, which is asymptomatic. She says she's not really feeling sick, and she doesn't attribute her decreased appetite to her COVID infection. On assessment, she was calm, dressed in a t-shirt and yoga pants, sitting in the bed. She was noted to have numerous healed self-harm injuries on her bilateral lower extremities, both the forearm and like the upper part. It was numerous. You couldn't even count them. There were so many of them. But she was watching YouTube videos with her nurse who was at the bedside. She had issues making eye contact with our team during our interview, and her communication was evasive. She's unable to directly answer most of our questions and frequently said, I don't know, when asked questions during our interview. She describes her mood as down. She says she's ready to go home, and she denies any suicidal ideations. So for Axis 1, it's major depression, panic attacks, and Tourette syndrome. Axis 2 was deferred. Axis 3, seizures, bilateral lower extremity clonus, metabolic acidosis due to her suicide attempt. Axis 4 is she's been having some difficulties with her sexual orientation and interpersonal confrontations, and also some difficulties in school. Axis 5 is 70. So the plan for her, she has been medically cleared, and she's going to be admitted to the inpatient psych unit at the University of Michigan. And we got consults from her grandmother, so she will be transferred later today. I ended up finding an article that talked about suicide prevention and mental health care for the adolescent population. And it just says that since COVID started, a lot of psychiatric providers are transferring their care over to online treatment, but or internet treatment. But since there are some people who can't afford it, internet access, or are illiterate in that realm, it just only has further exacerbated the problem. All right, let me know if you have any questions.